Hello, my name is Michael Simpson, and I am the Senior Speech-Language Pathologist here at Ballard Rehabilitation Hospital. March is Brain Injury Awareness Month, and in acute rehabilitation, we treat many patients that have had a variety of traumatic brain injuries. Traumatic brain injuries often occur from injuries from motor vehicle accidents. They can happen from other traumas, falls, concussions, many different aspects. Our therapy team here at Ballard Rehabilitation Hospital is geared to help people that have had traumatic brain injuries in many ways. We use technology to assist us and make traumatic brain injury recovery faster and more efficient. People that have traumatic brain injuries are a very wide, heterogeneous group, making what we do here at Ballard an important aspect of their recovery. We use individualized assessments and treatment planning to help us determine appropriate short and long-term goals for a patient during their stay. Technology use is a very important aspect of recovery from traumatic brain injury, and here at Ballard we use many different ways to help have technology help us following traumatic brain injury. Many persons in the acute stage of recovery after a traumatic brain injury find themselves having a condition called post-traumatic amnesia, which causes delirium and frequently very poor carryover and a reduced ability to learn. We often use technology to assist us in this phase because it helps to utilize the procedural memory systems in the brain rather than the more episodic memory, remembering things throughout the day. It's more about remembering learned things that you have used in the past. We use applications a lot of the time in technology and with traumatic brain injury recovery, such as this application that helps with spaced retrieval. It asks a question and then it gives you a countdown. It asks you a question like, what year is it now? And then shortly as the timer goes down, it will ask you the question again. And you can add a second question, what month is it? And it starts another timer that allows us to, okay, what year is it? And then you have to answer the question, and did they get it right? Yes, and if they do, it increases the timer, and then we have to work on trying to hold on to information in a repetitive, what month is it? It's the month of March, Brain Injury Awareness Month. This is a typical program we might use to help with spaced retrieval in the very acute phase of traumatic brain injury when it's difficult to remember. We also use for brain injury recovery other applications that help you with focus and attention, both visual attention and attention to task. And technology can be very helpful in providing education to patients and families about where in the brain or what parts of the brain or how the brain functions. And there are a wide variety of resources, animations, and other things technology allows us to provide good education and training for families as well. Of course, we also use electrical stimulation and other technological things for the treatment of swallowing impairments following traumatic brain injury, as well as many other things.